Hey guys, welcome to my channel, Everything Home Health. Today I'm going to be talking about how much you can actually make working home health. Keep in mind that this varies drastically across the country. Another thing that determines how much you can make is your experience. Nurses with more experience can command a higher salary. That goes without saying. What I first covered, the area that you live in. So, for example, I spent the first 10 years practicing in Missouri. I now live in Nevada, and there is drastic difference in pay. I've got my notes. I'm trying to make sure that I don't leave anything out because I will get to rambling on and lose focus of what I was talking about to begin with. Okay, so another thing that makes a difference on how much you can make is the size of the population and the area that you live in. If you live in an area that only has 70,000 people, the percentage of the population that actually will need home health is going to be way less than if you live in a big metro area that has hundreds and thousands of people. That just, goes without saying. So, back to how much you can actually make in home health. I was going to try and look up some research for you guys and provide some stats for, all 50 states. But in my experience, what you can find on these websites, huge discrepancy in what's really reported in real life. So, for example, I know this firsthand. I will sometimes Google how much, LPNs and home health in Nevada make. Not once have I ever come across anything accurate. So, I don't want to provide you guys with false information. So, the best way for you to figure out how much you can make, get some nurse friends. Ask them. Join a forum on here. And those are usually more accurate. I don't know where these websites get their data from, but they're always off. So I'm going to talk about specifically me, what I make. I make $5,000 a month after taxes, and I will be covering exactly how I managed to do that. Okay, so in Missouri, when I worked in Missouri, I made anywhere between $18 to $20 a visit. Here in Nevada, LPNs make anywhere between $32 to $45 an hour. Yes, huge difference. But keep in mind that there is a drastic difference in the cost of living. In Missouri, I rented a 4-bedroom home, huge backyard, garage, family room, huge kitchen for about $900 a month. Here in Vegas, a 4-bedroom is gonna run you $1,500 a month. So making $18 to $20 a visit, like that was okay for me there. If someone offered me that here in Vegas, oh no way would I ever take that. I wouldn't be able to survive. So keep in mind that where you live will determine how much you can make. And I will put a little snapshot of one of my paycheck stubs on here for those of you who, people are like, what? No way, she has to be lying, da da da. I'm not trying to brag. I am just trying to let you guys know that it is possible. You can make decent money. But of course, you've got to be strategic about it. And you've got to know the ins and outs of home health, which is my sole purpose of creating this channel. So stay tuned to future videos, and I will cover everything from how I make $5,000 a month, and that is with no overtime. This is working 5 days a week, 6 to 8 hours a day. So no, I'm not working 12, 16 hours, 7 days a week, because I know some nurses that do make, like $100,000 a month, but they're at work 360 days a year. So that's not the case. I'm not going to tell you that that's my secret, because it's not. Any questions? leave them below, and I will try and answer any questions asked of me. Thank you for watching, and stay tuned for my next video, which will be me explaining how to make intermittent home visits work, along with along with I keep trying to decide whether I should separate the two, because home health consists of intermittent visits and private duty, and I've done both. Right, I stopped doing private duty about a year and a half ago, however, so right now I just do intermittent visits, but for the past 13, 14 years I have done both. So I really want this channel to cover both. I don't know if I should lump them all in one video, lump the two in one video, or separate the two. So just stay tuned. I'll figure it out what works best. Leave feedback. Any suggestions? I'm open to suggestions. So yeah, thanks for watching.